So, good morning to teachers and friends. Now I'm going to present about the research on the spread of COVID-19. I'm Ken Hartanto from Neil Armstrong. In 2019, a new virus was identified in Wuhan, China, that has not been previously identified in humans. Then, just recently, the virus is spreading all around the world so fast that some countries are doing a lockdown and making sure that their citizens don't gather around and stay at home, especially those who are infected, need to be isolated. My research question is how COVID-19 spreads easily and brings death to certain people. Coronavirus are a large family of viruses that may cause illness in animals or humans. In humans, several coronaviruses are known to cause respiratory infection ranging from the common cold to more severe disease such as Middle East Respiratory Syndrome, which is called MERS, and severe acute respiratory syndrome, which is called SARS. The most recently discovered coronavirus causes coronavirus disease called COVID-19. 200 countries and territories all around the world will have reported a total of 785,000 confirmed cases of the coronavirus that originated from Wuhan, China, and a death toll of 37,000 deaths. So to protect ourselves, we need to clean our hands frequently with an alcohol-based hand rub or wash them with soap and water. Also, avoid close contact with anyone who is coughing or sneezing. However, the virus that causes COVID-19 is mainly transmitted through contact with respiratory droplets rather than through the air. However, with all of this happening, we should still stay calm and believe in God, that He will always protect us and will do what's best for us. Just like in Joshua 1 verse 19 said, "Have I not commanded you? Be strong and courageous. Do not be afraid. Do not be discouraged, for the Lord your God will be with you wherever you go." So, this is my data and analysis. As you can see that we can prevent or decrease the spread of COVID-19 by using a mask and other protective gear. However, only wear a mask if you are ill with COVID-19 symptoms or looking after someone who may have COVID-19. Because if you are not ill or looking after someone who is ill, then you are wasting a mask. There is a worldwide shortage of masks. So I suggest you that people will use masks wisely so that the hospital and the medical care places can have enough masks and protective gear for the patient and other people who need it. And in this graph, the risk depends on where you are, and more specifically, whether there is COVID-19 outbreak unfolding there. For most people in most locations, the risk catching COVID-19 is still low. However, there are now places around the world where the disease is spreading. For people living in or visiting these areas, the risk of catching COVID-19 is higher. Governments and health authorities are taking action every time a new case of COVID-19 is identified. Be sure to comply with any local restriction on travel, movement, or large gatherings. Cooperating with these disease control efforts will reduce your risk of catching or spreading COVID-19. COVID-19 outbreaks can be contained and transmission stopped, as has been shown in China and some other countries. Unfortunately, new outbreaks can emerge rapidly and anywhere. So it's important to be aware of the situation where you are or intend to go. From the data here gathered from China, while we are still learning about how COVID-19 affects people, older persons, and people with pre-existing medical condition, the older people can get infected and die easily, as you can see in the graph, especially people who have respiratory related illness, because COVID-19 is a virus that attacks our respiratory systems, and the older we get, the higher the chance of us getting a respiratory related illness. Also, people who like to smoke or vape, even if they are still young, the chance of dying after getting infected with COVID-19 is very high. So, my conclusion is the new coronavirus is a respiratory virus which spreads primarily through droplets generated when an infected person coughs or sneezes, or through droplets of saliva or discharge from the nose. When someone who has COVID-19 coughs or exhales, they release droplets of infected fluid. Most of these droplets fall on nearby surfaces and objects such as desks, tables, or telephones. People could catch COVID-19 by touching contaminated surfaces or objects, and then touching their eyes, nose, or mouth. If they are standing within 1 meter of a person with COVID-19, they can catch it by breathing in droplets, cough out, or exhaled by them. In other words, COVID-19 spread in a similar way to the flu. That's the reason why the COVID-19 is easy to spread among us. Most people infected with COVID-19 experience mild symptoms and recover. However, some can go on experience more serious illness and may require hospital care. The risk of serious illness rises within the age of 40 above. And people who is under 40 seems to be more immune to the virus. People but people with weakened immune system and people with conditions such as diabetes, heart and lung disease are way more vulnerable to serious illness. So that's it for my presentation. Thank you for listening and God bless you.